Thank you, Julie, for letting us interview you for this. First, describe what social science and environmental health research means to you.
I think it means using social science tools to understand what's going on with environmental health and how to create change to make people healthier.
Okay. Can you talk about how you specifically use social science and environmental health research?
So I've been at Silent Spring Institute for almost 20 years now, and it's a very strong integration of social science and environmental health science because we're creating a partnership between community members, breast cancer activists, physicians, and environmental health scientists, and just that interaction in and of itself is a complicated part of our day-to-day work that really draws on everything we know about people and how they interact and form alliances and what's important to them and how they want to move forward.
Can you briefly describe your academic training?
I have a PhD in a field called community psychology. It's a public health field, so it includes training in epidemiology, and I studied environmental psychology. Community psychology is about people in the context of social relationships and place. So it fits nicely with environmental health.
What path took you then to environmental health research from that training?
Well, I would say the path started before I went to grad school,
Okay.
and led me to study community psychology. I guess I've always been an environmentalist. I spent a lot of my childhood in the woods, studying bugs and trying experiments, mostly unsuccessful, at growing different kinds of moss in captivity. And then when I was in high school, I moved to eastern Washington, to the desert, near the Hanford nuclear facility. And I started thinking about technology and who's in charge of deciding what's safe. And that was kind of in the back of my mind. I wasn't necessarily thinking of making a career of that question. But as the environmental movement unfolded in the 1970s, those questions about who makes decisions about environmental health became more and more important to me. Right after I graduated from college, I was writing a monthly column about environmental issues, and as I would research each topic, it seemed to me that quite often the technical answer was known, but the will to implement it just wasn't there. And that is what led me to think about combining social science with my interest in the environment.
Was there kind of a seminal moment for you?
I guess, well, my first hands-on experience in environmental health research was my dissertation, which was about occupational hazards in the steel industry and how workers thought about what they could do to protect themselves versus what they needed to do together, perhaps through their union, to change the manufacturing systems and change how the plant was operating to protect everybody.
Mm-hmm. So you're really bringing in kind of the technical work, thinking about epidemiology and other tools, as well as the social science at that case. And when did you realize that you, in order to think about the problem in the way that you wanted to, that you needed both of those?
My dissertation has a very, very long epidemiology appendix, actually. So I guess that was when I figured out that both sides were important to me.
Mm-hmm. And what are you currently working on that's related to environmental health research?
Right now, I'm working on the best ways to tell people about their own personal exposures to environmental chemicals, especially chemicals that are especially the chemicals where we don't know a lot about them. So Silent Spring Institute has been focused on the study of hormone disruptors and breast carcinogens. And some of these chemicals are ones where we really don't know what level might be safe, or how they might be connected to disease later on. So my current work is about how to communicate to people what we do and don't know about environmental chemicals, and what we can do in a prevention-oriented framework.
Where do you envision this, your field specifically, and then maybe even the larger environmental field going in the future?
I think that the importance of communicating about environmental health science with the broader public is becoming more and more obvious, and there will be it will become more normal for researchers to tell their participants what they learned in a study.
And how do you feel the social science and environmental health kind of research methods have strengthened your work?
It's been kind of fun to see. Psychology, of course, is a field science. People are out there running around. At least in community psychology, we don't put them in the lab. We want to look at people where they live. And environmental health is a field science too. And it's been really fun to see the parallel interests in measurement error, in confounding the potential for variables that you didn't want to study to interfere with the things you did want to study. So it's been surprising to me how transferable the research design issues are from psychology to environmental health because of these field science issues.
Mm-hmm. What are kind of the benefits of taking this more interdisciplinary approach to your research?
I do think that community-based research is better in many circumstances. You get better information. And to do community-based research well, you do need to combine social science and environmental science. So I think that's a real strength.
Are there any challenges to this?
It certainly is challenging to do community-based studies, and it takes more time, it takes a lot of thought. And sometimes researchers are reluctant to do it, and if they have a bad experience, they don't want to try it again. So I'm excited about the prospect of training environmental scientists to be better at it, so their experiences will be positive and they'll be willing to keep going.
How do you think researchers should be trained in those tools?
I think that there's a real need for mentoring by scientists who've done it. I think there are some great books out there, but it's a kind of field that's hard to learn everything from a book, and it really is helpful to have partnerships, so new scientists who are coming into the field have a chance to practice with experienced mentors and to get advice when they come against a roadblock. My graduate school mentor was brilliant at it and practiced all the time, 24 hours every day, on his students as well as on any research community where he was working. And he really trained us to listen, to pay attention to what people were saying, and to be respectful, and down to the smallest detail about like how to share a meal in the field.
So how did you talked about your doctoral work being based a lot in epidemiology and things like that. So how would you say you gained the experience in that?
Well, psychology training involves a lot of focus on measurement and statistics. So there's a lot of overlap there with epidemiology. And then you get to practice in field settings as well.
Now, as you continue to do your work, what are some of the most important resources you have encountered to try to support your kind of interdisciplinary approach?
Well, my colleagues at Silent Spring are probably my most important resource. I'm so lucky to work with very creative scientists with experience in toxicology and exposure science. And they're just a terrific resource, and our activist partners are as well. They keep us honest.
What about somebody who's kind of starting anew? thinks about a large environmental problem that they want to tackle, and how do you think they should kind of get started to do that kind of work?
I think figuring out the right partnerships is the most important starting place.
Mm-hmm.
And figuring out who cares about a problem, and talking with them first, and then thinking about what kinds of tools can help understand that problem, and look for people who are really expert in those methods.
Okay. So one of your longstanding partners is Phil Brown.
Mm-hmm.
How did that start? How did you find each other?
Well, Phil was working on a book about breast cancer activism, and he wanted to interview Silent Spring staff members. And he approached us at a time when the Institute was new and feeling very vulnerable. So before I said yes, I read almost everything I could put my hands on that he had written. And I could see that he was very responsible about how he characterized the people that he had talked to. And I've learned since then that he always gives people a chance to review the work that characterizes them before it's published, which I think is a really important method. So I met Phil when I read a lot of his work and decided he was a good guy and trustworthy. And then he came and interviewed many of us and wrote about Silent Spring and the breast cancer activist movement in ways that were actually very informative and helpful to our board of directors. It's been an uphill battle because when we started out, environmental studies of breast cancer were really kind of fringe, and the medical and scientific community didn't think that was an important place to look to address breast cancer. So there was a huge amount of skepticism about our work, and I think our board of directors was struggling to understand why it was so hard to get funding and to pursue the work and to get people to pay attention. And Phil's work was extremely valuable in showing how the infrastructure of vested interests was working against us. And I think that helped our board of directors feel more confidence because they could understand that it was going to be a tough road. Well, I think that his work helped show how it wasn't our fault. It wasn't a personal failure.
Mm-hmm.
It was part of a broader structure that industry and other interests, the medical community included, were focused elsewhere in the struggle to figure out what was going on with breast cancer.
Do you feel like things have gotten better?
Well, we still have to remind ourselves that Silent Spring Institute was founded specifically because the big cancer organizations were not focused on prevention. So when we go to look for money, we have to remember that there's only a teeny tiny slice for prevention, and that's why we exist and that's why we're needed. But I do think things have changed enormously, and I'm incredibly proud of the contribution that Silent Spring Institute has made to that change. There have actually been 3 major statements in the past 3 years, starting with the President's Cancer Panel and then an Institute of Medicine report, and most recently an interagency report on breast cancer and the environment that cited 11 Silent Spring Institute studies and really adopted our precautionary approach to breast cancer and the environment, which says we should be looking at chemicals that have biological activity that suggest they're linked to breast cancer. And then we should be looking at human exposure. And when we have those 2 pieces, we need to start beginning to think about exposure reduction. So when we started out, the idea that there would be 3 major reports saying that prevention is a really important piece of the cancer agenda for breast cancer, and specifically focusing on the environment and environmental chemicals, that's a huge achievement.
Is there something about kind of taking the precautionary approach and thinking about prevention of disease that lends itself more towards an interdisciplinary approach?
I do think that the issues with environmental chemicals and health are inherently interdisciplinary because, for one thing, it's so hard to control your exposure as an individual. So it's going to require policy change. And policy change, of course, is a very complicated process.
Are there any other kind of thoughts you would like to share?
I would like to say this has been incredibly rewarding work, and there are not nearly enough people doing it. So I think there's a lot of room for new scientists to come into this field to start using social science tools to address environmental health problems, and on the environmental health side to start thinking about how to use social science to build partnerships and improve the impact of research.
Could you just first briefly describe this study?
So in 1993, the state of Massachusetts, for the first time, published a book of cancer incidence by town. And a majority of towns on the Cape turned up with higher breast cancer incidence than the statewide rate. And leaders in the Massachusetts Breast Cancer Coalition saw that immediately and said, wanted to know what's going on here. And they actually founded Silent Spring Institute to develop a major study to find out why breast cancer incidence was higher on Cape Cod. So the Cape Cod Breast Cancer and Environment Study actually began with a scoping process of looking at the Cape to see what might be different and interviewing lots of people, community members, physicians, public officials, to see what was important to them and what they knew about their community's history that might be a key to higher breast cancer incidence. And that was really the first 3 years of the study. And out of that came a focus. So over the first 3 years, the study looked both at what's going on Cape Cod and what is the science telling us about breast cancer and what might be the causes of breast cancer. And that piece led us to a concern about hormone disruptors, chemicals that can mimic or disrupt hormones, because we do know that estrogen is a breast cancer risk factor. So chemicals in the environment that could mimic or disrupt estrogen might also affect breast cancer risk. So after this scoping process, the study focused on two things that might be important aspects of the Cape that could be linked to breast cancer. One was the history of widespread use of organochlorine pesticides. There was a thought that Cape Cod is an isolated peninsula that sticks out into the Atlantic Ocean. And when DDT first came into use, there was a thought that if they really blasted it, maybe they could get rid of gypsy moth. So there was a lot of aerial spraying with DDT and then other organochlorine pesticides. The other thing we focused on was the potential for drinking water contamination. The beautiful sandy beaches represent a vulnerable ecosystem where the drinking water source is in an aquifer that's under the sandy soil. And in order to protect the marine sanctuary on the coast, wastes are disposed on land, so in septic systems. And so that means that everything that goes down the drain in your house is going into the septic system, potentially leaching out into the aquifer, which is also the drinking water supply. So we were concerned about leaching consumer product chemicals and hormones from our bodies, contaminating drinking water in a way that might increase breast cancer risk. So the Cape Cod study, after this scoping period, we began a case control epidemiologic study that included 2,100 Cape Cod women, half of them diagnosed with breast cancer, and half matched in age. And we tried to reconstruct historically how the women might have been exposed to hormone disruptors from the pesticide spraying and from drinking water contamination. Of course, breast cancer develops over many years, so that was why we wanted to use geographic information system to try to go back and estimate exposures years before the women had been diagnosed. We also began some other studies that were more directly focused on understanding exposure in modern days. Because of course our real goal was to prevent breast cancer, to bring breast cancer incidence rates down on the Cape. So we included an unusual and innovative component where we were directly measuring levels of chemicals in people's homes, in air and dust and in urine samples.
So was it during the scoping process or maybe even beforehand that they really focused on the potential environmental contributors to breast cancer?
Leaders in the Mass Breast Cancer Coalition felt strongly that there had been a lot of attention on mammography and treatment for breast cancer, but to really solve the epidemic, you needed to look at prevention. And many of the lifestyle risk factors for breast cancer, many of the established breast cancer risk factors are things that you can't really change, like how old you were when you got your first period, or even how old you were when you had your babies. So they wanted to focus on environmental factors that you could change, like your exposure to chemicals. I think really the most important thing that came out of the case control study was a very deep understanding of the frustrations in breast cancer and environment epidemiology. We tried very hard to reconstruct women's exposures decades before. We got the maps that were used by the pilots who were doing the aerial spraying for pesticides, and really reconstructed. We had records on where they had sprayed and how much and what it was, and we went back similarly to look at historical drinking water records. But even so, when we analyzed the data, we could see that we just were not adequately capturing exposure back in the years that would matter. So we really need to know what women were exposed to early in life, and the science since then has underlined that many times over, that there are risk factors for breast cancer before a baby girl is born. When she's in the womb, there are influences on the development of the breast even at that time, and then during puberty and up through the first full-term pregnancy. So I think one of the most important things that came out of the epidemiologic study was the deep understanding that we were not doing a good enough job reconstructing historical exposures, and that breast cancer prevention research was going to have to move away from epidemiology and take a precautionary approach that focused on biological activity in the lab and reducing exposure to suspect chemicals. We also did have some important findings for the Cape. We did document, unfortunately, that women who'd lived longer on Cape Cod had higher breast cancer risk. And we showed that the higher breast cancer risk on the Cape was not due to an older population or women at high risk moving into the community or to any of the established breast cancer risk factors. So this is now the best documented region in the world where there's an unexplained higher breast cancer risk, and it strengthens the hypothesis that there may be an environmental factor at work on the Cape.
Why focus on the chemicals that you focused on?
We focused on pesticides and drinking water contaminants because of the potential to disrupt hormones. We know that breast cancer is a hormonal disease, and it's influenced by estrogen exposure. And some of these chemicals can influence, some of these chemicals are estrogenic in lab studies, so that raises concern that they would make a breast tumor grow and might be a tumor promoter.
In terms of analytical tools, would you say they were mostly epidemiological based, or any other, did you bring any other tools to the table?
We really did advance the use of geographic information systems to reconstruct exposure history. I think that was an important contribution of the study. And we also did find some associations that could be important. It's very difficult in epidemiology to find, with the limitations in the epidemiology, it's hard to see an effect even if it's there. We did see some indication of an association between living near the cranberry bogs and higher breast cancer risk. And we know that pesticides were used very heavily on the cranberry bogs, so that raises concerns for a future study. I think that our exposure studies also made an important contribution. The household exposure study, which began on Cape Cod, has expanded now to California and is the most comprehensive source of information about exposures to hormone disruptors at home. We spend a lot of time at home. Americans spend 80 or 90% of our time at home. So it's really important to know what kind of chemicals we're exposed to at home every day.
What would you say is the role of the community throughout this? I mean, you talked about NBCC and activists starting Silent Spring so they can investigate this, but how has the community been involved throughout the course of the investigation?
Silent Spring Institute and the Cape Cod Study exist only because of breast cancer activism. That's still true today. The work we're doing even today is very much driven by what breast cancer activists want to know, and and we're able to do it because of their support.
What studies spawned, or kind of lines of inquiry have spawned because of what you found or your experiences on Cape Cod?
It's been amazing to see the studies that have been generated by our work. For one thing, the interest in flame retardants. Silent Spring Institute was the first to measure the brominated flame retardants in the U.S. Our toxicologist Ruth Ann Rudell heard about some work that was going on in Europe and added them to our analyte list in the household exposure study. And those were the first measures in the United States of indoor levels of brominated flame retardants. Then we found them at very high levels in California. But after our Cape Cod results were released, other researchers also began to study them in Boston and other places. So, and it's become a very important public policy issue to figure out safer ways to protect ourselves from fire without exposing ourselves to toxic chemicals. So that's been a very, very important outcome from the Cape Cod study. The Cape Cod study provided the first indoor measurements for 30 of the hormone disruptors that we tested. And many of these have now become important topics for research, including the phthalates and parabens. They've been included in the Breast Cancer and Environment Research Program and in some other studies of cohorts of children. So we really raised the alert that these are. We were one of the early alerts that these chemicals are very common exposures that need to be looked into.
Your focus now is a lot on ethics related to environmental health research. How did you get there? And would you say that started because of the Cape, or was it all along?
Well, one of the things that's wonderful about the Cape Cod study is that we know our study participants. And so 120 homes on the Cape were in our household exposure study. And after we got back from collecting all the samples, really just a few weeks after we got back from collecting all the samples in the household exposure study, we began getting phone calls. Cheryl Osimo, our Cape Cod coordinator, was getting a lot of phone calls saying, what did they find? When do I get my results? And because we really are accountable to breast cancer activists and Cape Cod residents, it really just wasn't going to work to say, I know, but I'm not telling you. At that time, it was uncommon for researchers to report to participants on chemical exposures unless they were medically relevant. But the chemicals we're studying were just beginning to be studied, so they couldn't be medically relevant yet. But even so, we felt that our participants had a legitimate right to know. They participated in our study and really were the creators of our study. So it seemed like they owned the study as much as we did, and we needed to report back to them what we had found. So then we began developing methods for reporting results, and that it wasn't easy or obvious how to do it well, because the results are complicated. We should have thought about that in advance, but we really didn't. We were very surprised when we realized how unusual it was to report study results to participants. It does seem like when you think about the basics of human research ethics, and one of the standards is to benefit your study participants and to respect them. So it really did seem important to us, even in the framework of established research ethics, to report results to individuals. And in the context of a community-based participatory research framework, it's a no-brainer that you really need to collaborate with your participants. You really need to share your knowledge with participants.
What kind of hurdles did you encounter in terms of suddenly now convincing people who were funding the study and otherwise that you should report the results back?
There were many, many conversations about the best way to report results. And some of those conversations were with the Department of Public Health. The Department of Public Health had funded the Cape Cod study. It was the Cape Cod study was funded by an appropriation of the Massachusetts legislature that was administered through the Department of Public Health. So so they were involved, and the Massachusetts Cancer Registry was also involved, because half of the women in our study had been diagnosed with breast cancer and identified through the cancer registry. When we were getting ready to report our results, the Department of Public Health was quite worried that people would be unduly alarmed. And I think they also felt uncomfortable that people would want answers that we really couldn't give, because there is a lot that's unknown. So it did take many conversations to work through the issues involved in reporting results to individuals. And so public health officials were involved, and eventually even elected officials. There were many meetings to figure out exactly what to say about our results. And Bev Vicelli, who was president of the Massachusetts Breast Cancer Coalition, was at my side at some of those meetings, and Senator Therese Murray, and other scientists. Dr. Dave Ozenoff, who's a very respected environmental scientist, was with me sometimes, and Phil Brown as well. And so we were very fortunate to have many allies who supported us through that process.
If somebody's going down this road now, so they're starting a large epidemiological study or an exposure study now, and they're trying to think about ways that they can bring in participants. What are the kind of most important resources for them in thinking about research ethics and report back ethics and community involvement in projects?
Well, on report back, we're about to publish a handbook that we hope will be good guidance for people who want to try this. And I hope many researchers will start reporting individual results. It's been very meaningful for us, and it's actually influenced our science. The focus on individual results, it's a different mindset than usually you're looking at the median or the typical result. And when you have to tell somebody what you found in their house, it focuses your attention on unusual circumstances in a different way. So and that led us actually to the discovery of a previously unknown source of exposure to PCBs. So I hope scientists will do it not partly because it's right, and partly because they'll learn things from the process. In addition to looking at our experience, which I hope will be helpful to other people, I do think it's helpful to think about consulting community members, because different communities are different, and different kinds of communications will work in different settings. And in getting permission from IRBs or from funders, it also can be helpful to have allies in the community expressing their view that they do want their results.
Is Silent Springs still involved on the Cape, and if so, how are they involved on the Cape?
Our current research on the Cape is focused on drinking water. We've tested both public and private wells and found contaminants in a majority of wells, including pharmaceuticals like the ear infection antibiotics, and some perfluorinated compounds, sometimes at levels that are higher than have been reported anywhere else. So we continue to be quite concerned about drinking water contamination and are trying now to evaluate different solutions that would help Cape Cod communities get away from the existing septic system technologies that are really not working well enough.
How do you think the community reacted to having a research organization really dedicated to studying their problem?
Well, Mass Breast Cancer Coalition, when they first discovered the high incidence on Cape Cod, they went to the legislature and got $1 million in funding to figure out what was going on. And then they took the unusual step of deciding that they were not going to give that money out to academic researchers to do their own thing. They wanted to keep it, and founded Silent Spring Institute, which is led by a public interest board of directors, to lead the study. We do collaborate with researchers at universities. Boston University Boston University and Harvard were among our important partners in the Cape Cod study. But the activist leaders really wanted to have a new way of doing research that would be led by a public interest board and accountable to them. We certainly have had to establish our credibility, and that's one reason why we focus so much energy on being sure that our work is published in the high-impact, peer-reviewed journals, because that's a way that people can know that the science is good. And we also, on the Cape, have tried to be in touch with physicians because they're talking to people all the time, and we want them to be able to understand our work. Boston University also has a strong presence on the Cape and has done some important research, including a couple of studies that did show associations between specific drinking water contamination scenarios and breast cancer risk. And I think that has also been important to the community.
Are there any other things that you want to share?
I think that interdisciplinary work has been a difficult path in the past. I do think that's changing. If you look at the National Institute of Environmental Health Sciences strategic plan, you see a lot more focus on transdisciplinary work and a specific understanding of the potential role of social science.